of a scenario that might appear in the PLAB 2 Professional and Linguistic Assessments Board exam, which assesses practical skills for doctors wanting to practice in the UK. Scenario: consultation with a teenage patient. Scenario brief: you are a GP. Your next patient is Sarah, a 15-year-old girl who has come to see you alone. She looks anxious. Your task is to take a history, assess the situation, and provide appropriate advice and management. Key points to address. 1. History taking. Establish rapport and ensure confidentiality. Ask open-ended questions to explore why Sarah has come to see you. Inquire about her general health, any symptoms she's experiencing, and any relevant personal or family medical history. Ask specific questions about her menstrual history, sexual activity, contraception use, and any concerns she might have. 2. Assessment. Determine if Sarah is Gillick competent, i.e., whether she has sufficient understanding and maturity to make decisions about her own health care. Evaluate any potential safeguarding issues. This includes assessing for signs of abuse or exploitation. Consider her mental and emotional well-being. 3. Management. If Sarah is sexually active and seeking contraceptive advice, follow the Fraser guidelines to determine if you can provide this without parental consent. Offer appropriate advice on contraception, STI prevention, and safe sexual practices. If there are safeguarding concerns, e.g., significant age gap with sexual partner, signs of abuse, discuss the need to involve child protection services sensitively and appropriately. 4. Documentation and follow-up. Ensure thorough documentation of the consultation, including her competence assessment and any advice given. Arrange for appropriate follow-up or referrals as needed. Example consultation dialogue. Hi, Sarah. I'm Dr. Smith. How can I help you today? Hi. I'm not really sure how to start. That's okay. Take your time. Anything you tell me here is confidential unless I'm worried about your safety. What's been on your mind? Well, I've been really worried because my periods have been irregular, and I'm scared I might be pregnant. I've also been having some pain down there. I see. Thank you for sharing that with me. I'm here to help you, so let's go through everything step by step. When did you first notice the irregular periods and pain? Continue with detailed history taking, assessing her understanding, and providing appropriate management and advice. Conclusion. In this scenario, you must demonstrate effective communication, sensitivity to the patient's concerns, and adherence to legal and ethical guidelines. The ability to perform a thorough assessment while maintaining a supportive and non-judgmental approach is crucial.